Welcome back, class. Let's talk about the cluster B disorders. There are 4 disorders here, and these are the dramatic, emotional, or erratic disorders. We're going to be talking about antisocial personality disorder, borderline personality disorder, histrionic personality disorder, and narcissistic personality disorder. Let's start with antisocial. Again, the dramatic, emotional, or erratic disorders, their basic approach to life is violation of others, and their core belief is I'm entitled to break the rules. So I'm only going to discuss this one briefly in this video because I want you to see another video I did for my colleague, Dr. Wafiq Sabir, who teaches criminal justice, and he and I had collaborated, and he did a video on autoerotic asphyxia for our class, and I did a video on antisocial personality disorder for his class because a lot of people with antisocial personality disorder are criminals. So I'm just going to talk about this briefly, and then I want you to watch that video, which is a really interesting deep dive into the causes of ASPD, especially when it comes to the criminal types. There are basically 2 types of ASPD. The first type is more what we tend to think of. They're violent, they steal, they beat people up, they probably had conduct disorder as a child. This sort of stereotypically might be a gang leader. The other type you're probably less familiar with. They probably look pretty upper class, and they tend to violate other people rather than beating them up. They engage in money schemes. So Bernie Madoff is a classic example of this. I don't know if you've heard of him. You can look him up. Bernie Madoff was a New Yorker who convinced a lot of really wealthy people to give him his money in a pyramid scheme that was supposed to be a retirement investment. They lost all of their money because the whole thing was fake. And so Bernie Madoff is the other type of ASPD personality. These are people who violate social norms and laws. They lie and they con and they use aliases. They're impulsive and irritable. They get into physical fights, reckless disregard for safety of self and others. And this is very key. They have a lack of remorse. What are we going to do about these people? Treatment is helpful if people still have some capability of feeling remorse. But a lot of times by the time somebody has come to somebody's attention, they have lost the ability. Empathy is completely offline, and they've lost the ability to feel empathy and remorse. Can I make a suggestion? You know, I'm a developmental psychologist, and I think that the answer to ASPD is socio-emotional development training for parents and children in the very earliest part of life. So conscious discipline is socio-emotional training that parents can use in the home and that teachers can use in the classroom. I'm going to link a video in Blackboard for you called How to Make a Bully from Scratch. If you think of a bully as a person who probably has or is approaching antisocial personality disorder, what Dr. Bailey discusses there is from prenatal development to infancy to the toddler years, preschool, childhood, and middle childhood and adolescence, all of the red flags that someone might see. So a baby with a difficult temperament is at risk. A 2-year-old who knocks down other kids' blocks all the time rather than building their own tower. An elementary school kid who can't make friends. A late elementary school, middle school kid who is starting to hurt other people. These are all red flags, and they can be dealt with, and they're best dealt with when you've got a newborn baby with a difficult temperament, and there are things that parents can do. So watch the video, How to Make a Bully from Scratch, and then I will link to Dr. Bailey's interventions. What would you do? And that's just going to be optional for you because I know there's a lot of material. But if you want to go further, take my lifespan class in person, because I only do this in person. I can't really do it online. Or watch her videos and see what could you do to help a difficult temperament infant? What can you do to help a toddler who pushes and shoves all the time? What can you do to help an elementary school child make friends? There are things that can be done, and they're really effective. In fact, the final video talks to a former gang leader who was found himself in a conscious discipline classroom in his senior year of high school, and it changed his life, and he's now a trainer for conscious discipline. Who's the classic antisocial personality disorder character from the movies or TV? Voldemort. My daughter Hannah and I had a big discussion about this the other day. She's a big Harry Potter fan. I've read about half the books. He violates others. He has no remorse. He breaks laws. The discussion Hannah and I had, she asked me, what makes somebody like Voldemort? And I said, oh, let's talk about that. Because and I said, let's talk about it from the integrated model of abnormal psychology. I said, is there anything about Voldemort that would have caused him biologically to become so hateful toward others and cruel toward others? And she said, well, a spell was cast on him when when his mother was pregnant with him. Aha, that's a biological thing, we'll say. That there was a prenatal factor that wired him up wrong. And I said, well, what about cognitively? Does he have any beliefs that are wrong or that kind of drive his thinking, that you look at his thinking, you think that's not how it should be? And she said, well, he one time said, there is no good and evil. There's only power and those too weak to seek it. And I said, aha, that's black and white thinking. That is a cognitive distortion where people think only in terms of fully good and fully bad, and they don't see the gray area. And that is a cognitive distortion that can underlie antisocial personality disorder. It can also underlie depression. So I said, what is it? What might have happened with friends or family as he was growing up? What's the socio-emotional aspect? And she said that he was bullied. I said, aha, there we go. And then I asked her about culture, and she said, well, he grew up in a culture that hated muggles. Those are the non-wizards, for those of you non-Harry Potter fans. So from an integrated model, I think we can clearly see how it is that Voldemort ended up with antisocial personality disorder. Okay, let's talk. So watch the video on ASPD, and let's talk about the other three in this Cluster B series: dramatic, emotional, and erratic. The second one is borderline personality disorder. This is a really complicated one. It's also one that ends in death a lot. Tends to affect more women than men. This is a person who has no sense of self. They have abandonment issues, violent mood swings. They're extremely impulsive, and they hurt themselves. Their core belief is, I deserve to be punished. Here's a story about Mary. Mary's a 26-year-old African-American woman who presents with a history of non-suicidal self-injury, specifically cutting her arms and legs since she was a teenager. She's made 2 suicide attempts by overdosing on prescribed medications, one as a teenager and one 6 months ago. She also reports chronic suicidal ideation, explaining that gives her relief to think about suicide as a way out. When she's stressed, Mary says she often zones out, even in the middle of conversation or while at work. She states, I don't know who Mary really is, and describes a long-standing pattern of changing her hobbies, style of clothing, and sometimes even her job based on who is in her social group. At times, she thinks that her partner is the best thing that's ever happened to me and will impulsively buy him lavish gifts, send text messages and the like. However, at other times, she thinks, I can't stand him, and will ignore or lash out at him, including yelling or throwing things. Immediately after doing so, she reports feeling regret and panic at the thought of him leaving her. Mary reports that before she began dating her current partner, she sometimes engaged in sexual activity with multiple people per week, often with partners whom she did not know. Clinical description. This is the most serious and disabling of the personality disorders. About 10% of people with this die of suicide. This puts it right up there with anorexia, with a 15% death rate, as one of the most deadly of the mental illnesses. These people engage in frantic efforts to avoid real or imagined abandonment. Some people say that this is the I hate you, don't leave me disorder. They act like they act in ways that drive people away and drive people to actually abandon them, but they're terrified of being abandoned. And even if somebody is very committed, they are terrified of this and they try to keep people close. So they might become extremely clingy and expect the person to be with them all the time. This leads into this pattern of unstable and intense interpersonal relationships where they go between extremes of idealization and extremes of devaluation. So Mary might meet a new friend, make a new friend, and next thing you know, she's calling the new friend 5 times a day. Or the new friend is supposed to meet her for lunch and is 2 minutes late, and she's sending hateful messages, text messages saying, "Why are you late? Why are you not here?" And then when the friend is kind of put off by that, then she'll frantically try to keep the relationship. They tend to think relationships are more involved than they are. They go from casual friend to you're my best friend ever that I've ever known in my entire life, and we have to spend every minute together really, really fast, which of course puts people off. And so you saw this with her relationship with her boyfriend. She either idealizes him and says he's the best thing that ever happened to her, or she hates him and can't stand him and he's a total loser, which of course is off-putting to people. They have an extreme identity disturbance. They don't know who they are. One of the best descriptors I've ever heard of this is that they're people who don't know how they like their eggs. If I asked you, how do you like your eggs? Most of us have a preference. I prefer them scrambled. A person with borderline doesn't know. If they're dating somebody who likes scrambled, they like scrambled. If they're in a relationship right now with a friend who likes poached, they like poached. They'll dress like their friends dress. And then when those friends leave them and they get new friends, they'll dress like those friends dress. They wouldn't be able to tell you what their favorite color is or who they are or give you a good description of themselves because they don't know. They tend to be extremely impulsive. The clinical description, you have to be impulsive in at least 2 areas that are really, really damaging. So they either spend a ton of money they shouldn't be spending. They engage in sex with strangers a lot, substance abuse, reckless driving, or binge eating. And one of the other major factors with borderline is suicidal behavior and self-mutilation. Sometimes the suicidal behavior is actually an attempt to kill themselves, and sometimes it's an attempt to get attention. Either way, you treat it as though they were really going to kill themselves. They will often mutilate themselves. So cutting into the skin, masturbating with a knife, these kinds of things. They'll make a lot of threats about suicide attempts as well. What causes this? This is one of the more studied. You'll notice that in these lectures, some of the personality disorders don't have a lot of description of causes, and that's because not much is known, frankly. More is known about this one because it is more common and it's also more deadly. There's probably a biological sensitivity to being more emotional, more impulsive, and more suicidal via low serotonin. So they're probably born with sort of genetically low serotonin that leads them to be emotional impulsive. There are absolutely cognitive factors. Black and white thinking and split, or it's also called splitting, is one of those. We saw this with Voldemort. He does black and white thinking. Everything's either evil or good. You're either completely powerful or completely powerless. We see this with the borderline when they think that people are either totally amazing and up on a pedestal or totally the worst person they've ever seen in their life. They themselves are either looking absolutely stunningly beautiful or completely hideous. The traffic was either the worst traffic they've ever seen, or it was a total breeze. Okay, do you see this? They have this black and white thinking. A lot of people with borderline, not all of them, but a lot of people with borderline were abused as children. It might have been parental neglect, or it might have been sexual and physical abuse by somebody in the family or somebody nearby. They probably were born with a difficult temperament. Difficult temperament babies are impulsive, they're irritable, they're hypersensitive, they're dysregulated a lot. Again, if you take a look at the Becky Bailey videos I give you, she gives great advice for what to do with that difficult temperament baby to avoid some of the problems that can arise from that. And then Marsha Linehan is the premier researcher on borderline personality disorder. She has it herself, and she developed dialectical behavioral therapy. And she argues that one of the factors, and this is controversial, there's not, the evidence is not totally clear, but Linehan makes, I think, a really good argument that invalidating parenting is an issue. She says, an invalidating environment, on the other hand, refers to an environment that persistently disregards, ignores, or punishes an individual for expressing his or her needs and emotions. Examples of invalidation include physical, sexual, and emotional abuse, pervasive criticizing, minimizing, trivializing and punishing of the individual, and routine pathologizing of the individual as possessing socially undesirable personality traits. Let's unpack that for a second. Kid comes home from school and says, from first grade, and says, I don't like Mrs. Thomas. She's mean. I don't like school. A parent who, in a very well-meaning way, might say, oh, Mrs. Thomas is so nice. Yes, you do. You know you love school. You're going to go tomorrow and you're just going to love it. On the one hand, you can see how a well-meaning parent might say that. They're trying to do some cognitive reframing. On the other hand, you can see this totally just invalidated everything that child just said. And if that happens on a regular basis, I don't like the color blue. Yes, you do. Blue is a great color. I don't want to go to the park. I just want to ride my bike. Oh, come on. You're going to love the park. I feel uncomfortable around so-and-so. Oh, she's a really nice person. What are you talking about? My favorite color is peach. What? That's a stupid color. Okay, all of these are things that can easily happen within a parent-child relationship and are invalidating. A child who is emotional and tends to be easily upset, as a person who goes on to develop borderline would be, and is told to not cry or is made to feel like their emotions are burdensome to others, is experiencing invalidation. A kid who cries because they're upset about something and the parent trivializes it and says it's not a big deal and why are you crying, is being invalidated. A parent who doesn't like a particular personality trait, maybe it's the impulsivity or the emotionality of the child, and talks about the child as having these undesirable personality traits, is invalidating. What all this does is it says to the child, your ideas are wrong, your thoughts are wrong, your feelings are wrong, your instincts are wrong, and I'm the one who's right. And so a child like that can grow up to think that all of their thoughts and feelings and emotions are not to be believed and are incorrect. And so they just constantly look to others for the right answer. So they grow up to be people who have no sense of self and don't know what kind of eggs they like for breakfast. People with BPD, we've saw with some of the other disorders, they're not distressed and they don't want any treatment. People with BPD are very distressed. They are very distressed and they often seek help. Unfortunately, a lot of clinicians don't want to work with people with borderline because they're notoriously difficult to treat. The patients are often non-compliant, they're suicidal, they abuse drugs, they're erratic, which makes treatment really, really hard. For a long time, people thought borderline could not be treated. But then came Marsha Linehan with dialectical behavior therapy. Some of the mood stabilizers can be helpful, but really you've got to have DBT. What she does with DBT is she first treats the behaviors that cause harm, then those that interfere with therapy, and then those that interfere with quality of life. She teaches the patient to identify and regulate their emotions, to learn some problem-solving skills. She gets some treatment for past abusive experiences, and she teaches them to trust their own responses. I have her one of her manuals for dialectical behavioral therapy, and I put a few examples of some of the worksheets she uses with her patients so that you could see those. I think they're fantastic for behaviors aside from borderline. Anybody who has trouble with emotion regulation can find these really, really helpful. So take a peek at those when you have a chance. who might have borderline? I couldn't think of anybody in the Office or Harry Potter world, but it's pretty well known that Princess Diana almost certainly had borderline personality disorder. Clearly, she was treated very poorly by Prince Charles, but even before that, she had abandonment issues and was terrified of being left. She did the idealization, devaluation thing. She idealized Prince Charles as being perfect and handsome and brilliant, and then later saw him in the complete opposite way. She always lacked a sense of identity, and she was anorexic and suicidal and threatened suicide a lot. I suppose this is controversial, but everybody's pretty much in agreement that she fits the description of borderline personality disorder.